top priorities. When I was in the Senate, I worked across the aisle to expand the Healthy Michigan Plan. One of the key architects of the legislation was the Senate Majority Leader, Mike Shirkey. He was in the House back then. This year, for the first time, enrollment in Healthy Michigan surpassed 840,000 Michiganders. As of this week, we've added nearly 180,000 enrollees since the pandemic began. But there are still thousands more who need coverage, and many who've lost coverage this year. If you haven't signed up yet and think you might be eligible, don't waste a minute. Visit healthcare.gov and get signed up ahead of the December 15th deadline. It's crucial that everyone who needs care can get it, whether we're in a pandemic or not. Before Thanksgiving, I sent a letter to the legislature urging them to pass a $100 million relief bill to provide support to families and small businesses in Michigan that have been hit hard by the pandemic. With the record numbers of people who are unemployed this year, we truly need the federal government to work together and pass a bipartisan relief bill that gives support to the people who need to put food on the table and can't. They can't afford to wait, and neither can we. And that's why I look forward to working with our legislature here at the state level to send $50 million in relief to unemployed Michiganders who need it most. While it won't be enough, it will be a bridge to help until additional federal relief comes. And I also asked the legislature to work with me on a $50 million program to provide relief to hardest hit small businesses, businesses like restaurants and bowling centers and entertainment venues. I'm hopeful the legislature will work collaboratively with my administration to provide this much needed relief. But that won't stop me from doing everything we can to help. So, effective immediately, most entertainment and recreational venues and restaurants that depend on indoor dining can postpone their monthly sales, use, and withholding tax payments that are due December 20th. They can postpone them until January 20th of 2021. The State Treasury will waive all penalties and interest for 31 days. This is a crucial step in helping our businesses that are struggling, but we still need the legislature and the federal government to act. There is light at the end of the tunnel, but we will not get there unless we all do our part. On this, the first day of the Hanukkah season, it is important to acknowledge the light, to strive for the light. I will continue to do my part to keep all of you informed. We will continue to follow a fact-based approach to eradicating this virus. The leaders on the Protect Michigan Commission will do their part to ensure that everyone in Michigan has a plan to get vaccinated and feels comfortable doing so. And we need everyone to acknowledge personal responsibility that we all have in fighting this virus. And to please do your part by wearing your mask, avoiding gatherings, practicing social distancing, and washing your hands frequently. With that, I'd be happy to hand it over to Dr. Janae Caldew.
Thank you, Governor. Good afternoon. So we are now at 415,200 cases, and as the Governor mentioned, over 10,000 deaths, 10,213 confirmed as of yesterday. I can tell you that these cases and deaths are not just numbers. These are people's family members, their friends, their colleagues, and every life lost was an important one. I'm an ER doctor, and I just worked a shift in the emergency department this past weekend. I can tell you that people are not just automatically recovering from this virus. This is not a cold that you just get over. Many people are still presenting to the emergency department weeks after they have been diagnosed with complications. And we are still learning more and more about the long-term health consequences of having this virus. So we just have to remain vigilant. So here's where we are on the 3 key metrics that we are tracking. Cases are at 514 cases per million people per day overall as a state, and have been declining for the past 19 days. All areas of the state have seen a decline in the case rate. The percent of tests that are positive is at 14%. This number has been fluctuating up and down for the past few weeks, but has not changed significantly and is still quite high. Hospitalizations are trending down overall for the past week and decreased in all but 2 regions in the state. Currently, 19% of inpatient beds have COVID-19 patients in them. We've seen a slight decrease in testing as well. The state averaged a little over 56,500 tests a day last week compared to over 59,000 tests per day the previous week. It is so important that people seek a test if they feel sick or think they may have been exposed. That is the only way we will be able to know exactly where this virus is so that we can slow its spread. There are hundreds of testing sites across the state, and many of them are free. You can go to our website, michigan.gov/coronavirus test, to find the one that is nearest you. We also continue to focus on contact tracing. We are still seeing far more cases every day than our state and local health department staff are able to keep up with every day. This means that there are people with the virus who may have a delay in getting in touch with a public health professional to talk to them about their close contacts. These close contacts risk having the virus themselves and spreading it to others. One way we can all help solve this problem is to download the My COVID Alert app. This is a free app that protects your privacy and lets you know if someone you have been in close contact with has the disease. You can download it in the App Store, or you can go to our website, michigan.gov/coronavirus. So as the governor mentioned, our team at MDHHS is actively preparing to be able to distribute a COVID vaccine when one is approved. This could happen as early as next week. A vaccine will only be approved when it has gone through 3 phases of clinical trials, including tens of thousands of people. And the top scientists and doctors in the country have reviewed the data and determined that the vaccine is actually safe. There are 2 vaccines right now that are in the final approval processes. Once they are approved, we expect to receive a limited allocation of these vaccines and expect to receive shipments every week that will go to our hospitals, our local health departments, our pharmacies, and other partners. Based on recent estimates from the federal government, Michigan will receive about 84,000 doses of the Pfizer vaccine if it becomes available next week in that first allocation. The Moderna vaccine is a different vaccine that is just behind the Pfizer vaccine in the approval process. If it is approved, and that may be later on this month as well, recent federal estimates suggest we will receive about 173,000 doses of this Moderna vaccine in our first shipment. These are both estimates and depend on the federal government and the manufacturing process. The amount and the timing of these shipments could still change, but we are still making plans to send vaccines to hospitals and local health departments across the state that have the ability to administer and store them. As the governor mentioned, the first priority for vaccination will be frontline healthcare workers, as well as people living and working in long-term care facilities. As we get more vaccine, we'll be able to offer the vaccine to more and more people, including other essential workers, people who have underlying medical conditions, and people who are over the age of 65. We hope that by late spring, we will be able to offer the vaccine to the general public. It is important that every adult in the state starts making plans for getting the vaccine. Talk to your doctor now about your risk factors and when the vaccine may become available to you. Know that you will need to get 2 doses of the vaccine, spread 3 weeks apart if you get the Pfizer vaccine, or 4 weeks apart if you get the Moderna vaccine. And it is very important that you know what to expect. These vaccines work by preparing your body to fight the real virus if it comes into contact with it. That means that many people will get mild symptoms after getting the vaccine, like a sore arm, a low-grade fever, or general malaise. That is something to expect, and it means that the vaccine is working. These are the types of things that you should be planning for and talking to your friends and family about. Also, please go to trusted sources for information on the vaccines. The state already has a website, michigan.gov/COVID vaccine. You can go there and find out information about the vaccine approval process and what to expect if you receive a vaccine. I'm thrilled about the announcement today of the bipartisan Protect Michigan Commission, and I'm honored to co-chair it with the Lieutenant Governor Garland Gilchrist and several other leaders across the state who have been champions for the lives and livelihoods of all Michiganders. Public health should not be political. We are all in this fight to eradicate the virus from Michigan together. I'm excited to work with this group of leaders to make sure Michiganders have the information they need and access to these life-saving vaccines. 2020 has been hard, but vaccines will be available soon. We are cautiously optimistic about the data that we are seeing. I ask all of you to continue to do the right thing. Wear your mask to protect yourself and others from the virus. Wash your hands frequently. It's still not too late to get a flu shot, and you can start planning for when you will be able to get the COVID vaccine. Also, it will be challenging, but we all have to think about creative ways to celebrate the winter holidays this year. There is simply too much virus in our community for us to be able to gather in groups like we normally would during the holiday season. So let's all double down and focus on what we can individually do to end this pandemic here in Michigan. And with that, I'll turn it back over to Governor Whitmer.
Thank you, Dr. Khaldun. With that, happy to open it up for a few questions.
Thank you, Governor. Our first question will come from Rachel with WWMT.
Hi, Governor. I was just wondering if you can tell me how the Michigan National Guard is helping out with the distribution of the vaccine.
So I think I'm going to actually bring Dr. J back up here to chat with you a little bit about that, about the Guard.
Yes, the National Guard and General Rogers has been a great partner in our vaccine distribution process. We have already reached out to hospitals and others who believe they may need assistance with actually having people administer the vaccine. So the National Guard, at least initially, will be having teams that are helping some of the hospitals that reached out for support in administering the vaccine.
Our second question will come from Jacob with MERS.
Hi, Governor. How realistic do you see the legislature passing a COVID package given the House just lost a week of session? And secondly, do you believe the video that Representative Cynthia Johnson posted on Facebook was appropriate?
You know, let me start, of course, with the first question. And you know, I know that the legislature has had a lot of COVID, apparently, through the ranks of legislators and staff. Unfortunately, that's the case, and that's cutting into their meeting time this week. I'm hopeful that they can safely come in and do a few things before they adjourn for the year. There are a lot of people that are struggling right now that are counting on our legislature to help them get through this tough moment. And so it is my genuine hope that they can do that, but that they do it safely, and that all members wear masks, and that they give one another a little bit of grace and show each other the respect and compassion to keep one another safe as they do that. But there are a lot of restaurants, there are a lot of small businesses, and there are a lot of individuals who aren't going to make it if they don't come in and help us, give them a little bit of help right now as we're waiting on the federal government to get their act together. So that is my hope. I believe they can do it. There is enough time, but I am cognizant of the fact that they need to stay safe when they do. Second, with regard to Representative Johnson, you know, I think that this is a woman who has been through a lot. And I think it's important that every single one of us give one another a little bit of compassion and grace. You know, she's had a loved one in the hospital. She's lost a number to COVID. And the simple requirement that she show up to do her job last week at a hearing with Rudy Giuliani, where she was exposed to COVID, frankly, and everyone who was there was, has now made her the target of a lot of racist attacks and threats on her life. None of this is acceptable. None of it is acceptable. And I believe that it is crucial that we show one another some grace right now and some empathy and some compassion. I think that removing her from her committees is too far, truly. And I've reached out and asked the incoming House leadership to reconsider that. We all need to put our focus on our common enemy, which is COVID-19. Any action that happens in the legislature in the coming days or weeks should be focused on that and that alone and keeping one another safe. And I think that's all I've got to say on that subject.
We will take a couple more questions. I'll turn it over to Dave with the Detroit Free Press.
Sorry. Hi, Governor. Thanks for doing this. Earlier this week, a senator called for Director Gordon to resign. Can you just speak to the performance that Director Gordon has done and whether you think it would be appropriate for him to resign or to remain as the head of DHHS?
You know what? I'm not going to entertain partisan attacks on our leaders who have been working 24/7 to get our state through this global crisis. We're fortunate to have so many incredibly talented leaders here. And if more people who hold office would recognize that our enemy is a virus and stop trying to look for reasons to fight amongst one another and harness the spirit and the grit of the people of this state and focus it on the virus, we would all be a lot better off. That means our people, we would be healthier, and our businesses and our economy would be stronger. And I ask and encourage all leaders to, in this moment, refocus all of our energies on getting our state through this crisis.
Our next question will come from Rod with WDIV.
Yes, Governor, good afternoon. A couple of questions about the vaccine. In particular, I was curious if we have any more specifics on the rollout plan. I know that Dr. Calhoun talked a little bit about that, but it also begs the question, can the vaccine be enforced by state, by employers or schools? In other words, can somebody force you to actually take the vaccine if in fact you are or are not interested in having it?
So, Rod, there will be more details coming, and it's a matter of day or days when there will be plans finalized about what our cadence will look like in Michigan once there is a vaccine that is safe, effective, and approved and available for us to distribute. There are no conversations around mandates. I think that's important for me to be very clear on. I think any employer who is worried about making sure that their workforce is safe and healthy, they should be making plans right now for how they will encourage and or incentivize their employees to get vaccinated. A safe, effective vaccine is the strongest tool that we have against this virus once it becomes available. That and a mask, and that will continue to remain the case. And I think it's important that we all recognize, too, that vaccines are, this is a moment where we should all feel very hopeful and proud of the incredible strides that have been made. But we also need to make sure that we stay educated on where things stand and understand what a vaccine really means. It's going to be important that we continue to wear masks for a while, and I think we all need to understand that as a part of our ability to eradicate this virus. We're going to have to use all of these tools.
And the final question will come from Ross with WXYZ.
Thank you, Governor. With the Michigan House canceling session for the week due to COVID, does that put the state at any disadvantage as it relates to the rollout of the vaccine specifically?
Well, Ross, I don't think that it puts us at a disadvantage with regard to the rollout, but I do think that it's problematic for a handful of reasons. One is, it shows that if people congregate without masks, multiple households indoors for any length of time, you can have COVID spread, even if you're in the legislature. Second, the inability to meet this week could compromise our ability to get this additional COVID relief done, and that's my primary focus at the moment. With regard to vaccine rollout, we are hopeful that we will have vaccines here in Michigan in the coming days, and that we will be able to get our healthcare workers and nursing home residents and the first priority vaccinated. It will be a little while before we have vaccines available for the general public, but that planning is happening now. And so our ability to do that planning and to have the resources to do it is being undermined by a Congress that hasn't gotten this stimulus bill done. And so that is my primary concern. We want Congress to get their piece of the important puzzle completed before they take a break, and I'm hopeful that the legislature will do this $100 million that I've been talking about as well.
Thank you, Governor. Thank you, everybody. Stay safe out there.
Thank you.